Hey everybody, welcome back. This is Dental Unfiltered. I'm Matt Brown, your normal host, and I have an amazing guest today. Somebody I get to spend a lot of time with. We're both on the speaking circuit in dental, and us speakers and sponsors and vendors are pretty much a traveling circus where we spend more time together than probably with our real world friends, and we actually become real world friends. A lot of us really do connect. I would consider you a friend. Paul Goodman, I would consider a friend. Kelly Schwartz, a lot of people I would consider a friend that I've met through dental and I've really connected with. And two people in particular were especially nice to me when I was like a nobody new kid in dental. And it was you and Bob, who we now miss. There'll never be another Purple Cow Wow. And I know that was a big thing for you. It was a big thing for everyone. But the two of you probably opened up to me and accepted me the most in the beginning because I didn't know anybody. And you guys would go out of your way to talk to me. And then I felt like I had these two people. If I saw them at an event, I could like go over and socialize with them, and they would introduce me to people. And you probably don't know that, but you and Bob were probably the two nicest people when I got into dentistry, and I was this new kid. And you guys were like awesome. So Alan's with us today. Super respected speaker in the space, and he really focuses on like mental health and taking care of your body. And today we want to talk about total health with Alan Stern. And this is a subject that like we can go take you guys can go take cases on endo, courses on endo. You can go take CE on implants. But I think this is a really overlooked thing, and with our space and the stress dentists are under, I think this is should be a priority. And I think you're the only person making it a priority and creating awareness that I know of. So first, Alan, why don't you tell us a little bit about yourself and let's dive into that subject.
Now, first of all, thank you for those very generous words. Part of my mission, my daily goal in life, and it's written on the wall right above my desk, is let me continue to improve as a force for good wherever I go, no matter how excellent or flawed I may be. And I behave that way with intent. I behaved that way with you. And you're a human being. You have a great purpose, and you're also a very, very nice human being. So, it's always fun when we act with the intent of delivering good to people. So it's my honor and privilege to know you, and certainly with what you've given of yourself in your younger years. It's incredible. But anyway, thank you. Me, I'm very proud to tell you that I am less than 6 weeks away from being 6,001 years old. And I'm just getting started. Do the math, Brownie. Do the
Yeah.
math. Yeah.
Wow.
Um,
Six
it,
dozen.
it's 6,001 in 6 weeks.
You're great, Alan. You're looking good, bro. You're
Yeah,
high
it's,
energy. You're
yeah.
awesome.
Well, it wasn't always this way, Matt. And part of the big part of my story is that I overcame some tremendous externally and internally inflicted adversity. My mother was a Holocaust survivor. My mother went through atrocities and witnessed atrocities that even by today's standards are unthinkable. And my mother came out of there with the belief that Jewish people were put in this world to suffer. And that was,
No human should suffer.
my mother is my hero to this day. So let's make that clear. I was raised also by somebody who basically told me overtly and subliminally that I never amount to anything. Those were the things the demons I battled my whole life. Then dental school. And you haven't had the joy of going through dental school, but you have had the joy of meeting people who have. And for susceptible,
It's a very brave thing to do, and people don't give you guys credit. Being a dentist is a very brave profession because you can go through school and become a D4 and be in student loan debt and realize you hate dentistry. Like, that's very brave.
but the other problem that I went through is that for susceptible people, the dental education process was, and to a degree still is, less so, a frontal assault on your self-esteem. If your work's not perfect, it's garbage, and if your work is garbage, you're garbage. That is the subliminal message that we got. Now, I am not indicting the dental education system because that was the way the people thought back in the 70s and 80s and before. Break them down to build them up. Well, it doesn't work. If it worked in the past, it doesn't work anymore. And certainly on somebody as fragile as I was psychologically, it was tough. And it broke me down. And I spent a good part of my career trying to prove that I was something that I wasn't. And it was, and I trusted the wrong financial advisors, the wrong marketing people, the wrong practice management consultants. And all of a sudden, in my upper 40s, I found myself an extra $250,000 in debt with no increase in income to pay it down. That was my rock bottom, enhanced by my finding the right financial advisor who saved my life, who told me, Alan, sell your house. I say, what? Me? The great Dr. Alan Stern, 30-year practitioner. I worked my off to buy this house. Alan, look at your numbers. Oh. So I sold my house under duress. I was always solvent, but I sold my house. I bought a townhouse, and I cried for months, Matt. I drove past that old house every day, crying outside. Paul Goodman says crying inside. I was crying, wondering what I messed up. But the great inflection point happened at that time, because all of a sudden money didn't matter. I was intaking enough money to continue saving, to continue having fun. We were able to go to Vegas again and have fun, and we're saving money. And oh my goodness, then I started talking to dentists, to my colleagues. People like to talk to me. It's such a privilege. And I learned that so many of my colleagues were going through the same nonsense as I was. You know, the guy driving the Mercedes or the Rolls, that only means he's driving a Mercedes or she's driving a Mercedes. It doesn't, you don't know what price people are paying. And some very well-to-do colleagues went bankrupt. One colleague committed suicide. And that drove me into doing what I'm doing today. And that is reconnecting with your why, taking care of your brain, your body, your intellect, your emotions, and really redefining prosperity as a comprehensive package. I asked myself, and I looked at Fran, my wife of almost 49 years now, how much is enough? And we have more than enough. Life was so good for us, we didn't even know how good life was. And we want certain things, and we have them. And because of the business mistakes I made in the past, yeah, okay, I have more than most people in the world could imagine having, and I have less than some. Yes, so what? So what if I'm not Frank Spear, John Coyce, Lee Brady, some of the greats? But they each made me better. And I'm a little bit better every time I take CE. If I'm not our friend Mitch Rubenstein or Steve Rasner or John Nasty, these guys are giants, and they've accomplished clinically what many of us will not be able to do. But that doesn't mean they're God and you're trash. It means they make us better each and every day. I wouldn't hesitate to do a John Nasty or a Mitch Rubenstein or a Ripe Global or a Steve Rasner today, because I would set my sights a little bit different, my expectations a little bit different. And if I did the Pankey Continuum. It made me a better human being, a better dentist, and that's who I am today. So redefine prosperity. What do you want? Write it down and work toward it.
It's funny you mentioned the comparison thing, right? I mean, comparison is the thief of joy. It really is, 100%, right? And in my experience, and I'm really open. I talk about this stuff. Right after cancer and losing my leg, I went through a really tough period. And my comparison wasn't comparing myself to others. My problem was comparing myself to the former self.
Yeah.
That was a problem. And I had an attempt during that time period, and I had to seek mental health, and it was tough. And I think dentists have a flaw with this, and it's the perfection flaw that you just talked about. There's also the comparison flaw. And I will tell the listeners, and I promise you, I've said this before on the show, I've had big name coaches in the space who I won't say come to me for growth. And then I turn on their information on Dental Intel, and what's said on stage is not exactly what reality is. And I have, And also, like, do you really want to be that person with the rolls and the beach house and the lake house and the Ferrari? Who's like, do you want to be that person? Because there's a lot that goes along with that, and there's a pressure that goes along with it. It's not just being comfortable in the roles and people looking at you. There's a pressure to maintain that lifestyle. I do pretty well in the world, and I'm not cheap. I spend money on experiences for my family, but I drive a Jeep with cloth interior. Like, there's a point where it's like, why are we doing it? Are you doing it so other people see it? Or are you doing it because it really matters to you? I think that's a mental health issue. Like, if you're buying the roles, so it's like, hey, look at me. Ultimately, that's not going to bring you any joy at all.
Aside from the day you drive off the lot with it.
That's it. And then you have this thing in your garage that's depreciating like a rock in the ocean that costs the amount of a house. And then you end up in your scenario. It's funny when you were talking, we had Tom Orant on the show.
Oh, Tom is great. He's a buddy of mine.
Yeah, me and Tom are buddies too. We just had dinner in Boston. Me and Tom are close. And your story and his story are really similar.
Mm-hmm.
Your stories are parallels.
Yeah.
They really are.
Yeah. He lost more hair than I did.
Tom, so me and Tom both are bald guys.
Yeah, you and Tom. Sorry, Tom.
Yeah, me and Tom. Tom is a hero of mine.
But
Tom
yeah,
is somebody I go to
he's
for advice a lot.
fantastic.
Yeah.
And, I have 112 Alanisms now.
Okay.
Alanism number 1 is show me a person without stress and I'll show you a cadaver.
Yeah,
I think
100%.
it's Alanism number 38 is no matter how much you think somebody else may have, you do not know if you are willing or able to pay the price that that individual is paying. So it really is a matter in dentistry and in life of really connecting with yourself and understanding what you want to do with your dentistry. And there is more than one right answer. That's Alanism number 18. More than one right answer. And, John Nasty and Steve Rasner are incredible human beings. They're wonderful people and accomplished clinicians. But is that what I wanted in my career? And it wasn't. Knowing what I know now, I would dive into it. But during my career, that was not where my slightly uncomfortable zone was. My slightly uncomfortable zone was my practice. And I reaped the appropriate reward. I grew the practice in my way with good professional help after I got rid of the wrong professional help. And I practiced as me. After I sold that house, Matt, I figured out who I am. And I did dentistry the way I am with the people I wanted to work with who accepted me and trusted me and their view of health was congruent with mine. It worked.
Do you think when you sold the house and you removed that financial burden off of you, you then didn't have the pressure of like I have to do things to keep up? When you removed that, you then could explore the way you really wanted to do things in your practice and the way because the financial pressure was off. You were like, okay, well that's gone now. Now when I make decisions, I don't have the pressure of the perfect decision, and now I can try things and see what makes me smile and see what's best for my patients and see what's best for me personally because I don't have this thing pushing down on me.
Yes, exactly. And the other thing is, we know the 4 magic words that a patient tells a dentist to buzz off. I'll think about it. The dreaded 4 words, right? And you know what? When they said that, okay, I'll be here if you need, and I'll support you. I'll be here. And I didn't have any anxiety. Oh, are they going to accept that crown? Are they going to do that all on X? Are they going to do a full mouth rehab or those 8 or 10 veneers? Yeah, okay. I'll be here.
Yeah, when you don't have that financial pressure, that desperation doesn't come across in your chairside manner in the operatory. It's confidence and comfort.
And the other great thing, Matt, was I finally was able to spend time with patients, listening to them carefully, and really learning who they are and co-creating treatment plans with them that made sense to them. In fact, they're not treatment plans. I don't even talk about case acceptance. That's a dirty word. Collaborative agreement.
Collaborative agreement. Okay.
If you're my patient, Matt, you know you better than anybody. I know dentistry better than you do. we combine those two pools of knowledge with generous listening to each other, starting with me listening to you, giving you a chance to explore your options and figuring out what works best for you. The divorced single mother with children, with small children, who's up to her eyeballs in debt with really crummy teeth, to suggest to them or to pressure sell them an all on X, that's just dumb. That's not doctoring. You have to know what their limitations are, and you have to create an environment where an honest discussion happens, where you're on both on the same side of the box pushing toward their health. And that made me happy because sooner or later they came around.
Yeah, I think that dentists put a pressure on themselves of, I have to close it now. I have to get acceptance now. I have to get a yes now. And, I teach case presentation, case acceptance is probably the thing that I teach. It's the thing I teach.
Collaborative agreement.
Collaborative agreement. I might steal that. I stole some stuff from Kelly Schwartz, and I always give him credit for it.
Please feel free.
Yeah,
please feel free.
Use it. And I think that they don't understand that if they provided a good patient experience, they're gonna get more at bats to help that person. Like they think I get one at bat. If I don't hit a home run, I'm a failure. If you did your job and you did it right, and they realize you were the proper compassionate caregiver for them, there are more at bats. You are going to get more chances. And the other thing you can't control, which you alluded to, is life conditions allow somebody to seek dentistry. And the life conditions were not right then. Now, let's say the single mom gets married in 2 years to a husband that loves her, who's doing better in the world. That might be the time it happens. And if we've taken care of her all the way to there, when that door opens for her, you guys can help them.
Well, I would dare suggest, Matt, that first at bat is establishing trust and giving them a reason to come back. Now, at the Pankey Institute, they taught us, what does a patient owe you when they leave the office? They owe you nothing. What do you owe them? You owe them a reason to come back. And I had a secret weapon. And that was Fran, the front desk person that I've been sleeping with for I don't know how many years.
Oh, your wife?
Yeah, you said it, not me. Yeah.
Okay.
Yeah, and we treated everybody like they were coming into our house. And we treated them. I had a sign, and you can feel free to steal any of these ideas, Matt, because they're good. If they help one person, then I've fulfilled my mission.
I'm the same
way.
But
we had a sign above our front desk that says, "Enter as strangers, leave as friends."
Oh, that's so good.
Isn't that powerful?
That's so good.
Yeah.
Oh my gosh, that is. So you have a good, friendly front desk greeting when they come in. You make eye contact, and they look up, and the first thing they see is that.
Mm-hmm. Yeah.
Oh, I'm adding that to my patient experience training.
Please do. Please
That
do.
is so good, Alan. That's
Yeah.
like the best gem I've gotten in a while.
Now, I stole that from my friend Rudy Thompson, who's an incredible plastic surgeon on the Jersey Shore. He had that on his desk, and Rudy lived that way. He practices that way too.
Wow. So it's come in a stranger, leaves a family.
Enter as strangers, leave as friends. Yeah.
Oh, enter as strangers, leave as friends. I'm stealing that. It's good, Alan.
And to his credit, the young gentleman who bought my practice left that up there.
Oh, that's nice.
Yeah. Yeah.
That is really nice. That's awesome. Yeah. So,
yeah.
We have this comparison problem in dentistry. And I think it happens on a couple levels. I think we talked about the personal part of it. Why don't I have the roles, right?
Yep.
Then there's a professional part of it, which I deal with this a lot, where we service about 400 practices at my job, and I have dentists that come to me every day, and they're like, "Oh, my friend down the street's doing $250,000 a month. Why am I only doing 90?" And in my head, I'm like, "Your friend's not doing $250,000 a month. I'm sure of it." Now, I have some docs that do, right? They are out there, but they're like 1 out of 10, man. Like what I'm seeing is 150. You're doing a good job. Like if you're hitting 150, I think you have a lot to be proud of. 100 to 150, you have a lot to be proud of.
Are you, how much is enough? And what are you willing to do for it? Period. Doesn't matter. If Dr. Matt Brown down the street is doing $250 a month and he's happy, God love him. I'm doing a measly $150.
He might be in the practice all day and his kids might hate him.
Or he may be happy at it.
Yeah, it might be one or the other.
I worked with a very dynamic dentist who went from 2 million to 8 million. The gentleman, he's a great guy, nicest guy in the world. He's an all-on X machine. And you know what? I was in his office. I worked in I observed and coached in his office, and I couldn't do that. It isn't me, but it was him. And it is him, and he's loving his life. Yeah, okay, great. I wasn't doing any 8 million, but I didn't care. He needed some guidance that I was able to provide. And I was watching, I was celebrating with him. Well, I went to my practice and did what I did. And I was very content.
I think too. I think going back to something else we talked about before we got on the show. I think there's a problem too with in the military we call it planning back from the X, right? So if we're gonna hit a target, we say we're hitting this target this day, this time, this weather, these conditions, this many bad guys on site. We need this support, and then we start planning backwards from there. I think dental students come out of school and they look at the step in front of them and they plan and they don't know what the target is. They haven't framed what do I want out of dentistry. And I get a lot of dentists that aren't clients who find their way onto my calendar or they message me and say, hey, can I just talk to you? And I make time for dentists outside of my clients, and they'll get on and they're talking about all this stuff. I'm like, can I just ask you a first question? Okay, I have 3 questions I want to ask you, or three options. Like, all right, do you want a regular family practice, a good quality of life, work 3 to 4 days a week, make a good living for your family, and retire? Do you want to build a singular super practice, or do you want multiple locations? Because that's the 3 kind of basic routes. And I can't tell you how often I get this answer. Well, I've never thought about it. And I'm like, so you're trying to do all these things and trying to make all this money, but you never thought about what you want as like your hill that you put your flag on? That's amazing to me.
You know what I tell them to do, Matt? I tell them to go back to their dental school personal statement on their application.
Oh, okay. I never thought about that. I don't even know anything about that. That's interesting. Talk about that.
And are you living that personal statement? If you are, let's keep going on that ground. And if you're not, what has to change, you or the statement? Because we change over time. You and I are not the same people that we were 20 years ago.
I'm a different person now than I was 5 years ago when I started in dentistry.
Yeah, but what you really need to do is practice dentistry still, with all of the complaining that we have, and there's legitimate grounds to complain about dentistry, well, about anything really, but it still offers us choices. Lots and lots of choices. Fee-for-service, PPO, DMO, DSO, employee, employer, military, FQHC, research, sales. There are so many different choices. And then what do you want to do within that? What do you want? What is your BAM, your bare ass minimum? I'm sure you've heard that. And what do you want over and above that? And what are you willing to do? And tie that into your core values. Not mine, not Matt Brown's, not Paul Goodman's, but yours. And you find your path that way.
I think part of what you said about your statement going into going into dental school about why you're doing it, I think a good way to preface that, in my opinion, I'd love your thoughts on this, is are you being loyal to yourself when you're going in dental school? Yeah. Are you being outside influenced? And honestly, I call it dental porn. Like all these trendy crap that's on Facebook and YouTube and TikTok of like, you need to do this many arches a month and you need to do, it's like, why? I don't understand. Like, why do
right.
And it's just, and the stuff is really phrased down as, you should be doing this, or, you can do this. And it's like, but should I be? Is it for me? Right. And I think I never thought about it. A good like foundation to go back to check yourself is, what statement did I make before I went to dental school? And does that still align? And if it doesn't, why doesn't it align?
Yeah. My good friend, John Blumberg, John Blumberg is a expert on integrity. He wrote the book. In every sense of the word, he wrote the book, ROI, Return on Integrity. And we did a course, I got to do it again, Circle of Integrity for Dentists. And what happens is we start out ideal, right here. This is our moral center. And all of a sudden, over time, like a ship at sea, it just drifts off a little bit. And we say, yeah, I could get away with that. Yeah, all right. So this becomes our moral center. And we drift and we drift and we drift. And unless we are aware of it and correct, all of a sudden we find ourselves way outside of our own integrity, our own core values, and we don't go back. You have to really center on who you are. And that is not easy because 100% of us drift. We all do it.
No, no one doesn't. I mean, I would say as a captain, I'm a 6 out of 10. I'm out in the ocean quite a bit. I've been out in bad seas, and I may go like 100 miles out in the ocean for stuff. And you're right. Like, if you're a half a degree off course, that half a degree, 50 miles out, is completely not where, like, you weren't even close, right? And that, using that analogy is really powerful, because I see dentists that, like, there's a difference between clinically brave and trying something with the spirit of, like, doing what's best for your patient and keeping continuity of care in one location, and, like, you know, maybe pushing some work that is a little more expensive, and that maybe the work is valid, but kind of like really pushing them towards the more expensive thing. It does shift. I've watched young dentists that do startups, and 4 years later with us, their outlook is totally different.
Yeah. From a personal point of view, being my age, any male over 50 has this little thing called a prostate. By the way, the NBA called me last week and they asked me if I could give them my prostate to use in the finals. That's how big it is. Sorry, I can't resist that line. But I had a local urologist where I was bully me into signing an informed consent to have a prostate biopsy. My PSA went up, and all of a sudden, boom, 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 boom. This is a much longer story that I don't want to bore you to death with. And, we in dentistry and medicine have a BS meter. And I knew what this guy was doing. And I ran out of there so fast that he was recommending something that was not only not necessary, but contraindicated. And I recently went to another specialist here in my new town who tried to upsell me on treatments that had nothing to do with my complaint. So unfortunately, we have become the dirtiest word in the English language, don't you? Did I tell you that one? Providers. I would rather you call me the dirtiest New Jersey word having to comment poorly on my relationship with my mother than a provider.
Such a Jersey word.
Because we are doctors, we are clinicians, we are healers. And somehow along the way, we have lost that. And it is about the human being. And those two experiences with those two specialists, especially the urologist, because I was practicing at that time, gave me great pause as to how to treat a human being. This mouth can benefit by this treatment or this treatment. Oh, gee, I can make more money doing this. But wait a minute, what's right for the patient? Let's talk about that. And it all works out anyway.
Yeah, I mean, you're a dentist. Like, every single person on this planet needs you. I mean, like, if it like it's a target-rich environment from a business point of view, but from a fulfillment point of view, you have all these opportunities for personal fulfillment and helping people. Really fast story, and we gotta start wrapping this up. I remember the first time I met a patient who had benefited from my company helping them get to a practice. And I was visiting one of my practices in Florida, and she was getting snap-in dentures. And she was a recovering addict, and she was a single mom, same scenario. And the doc said, hey, one of your patients that you provided to us is here today getting her snap-ins. Do you want to be here? And I was like, for sure I do. And she put the snap-in dentures in, and she instantly looked like Catherine Zeta-Jones. And I said, are you single? And she's like, yeah. I was like, your standard for men should be raised very high now, because you look just like Catherine Zeta-Jones. and she was crying. It was the first time saw her smiles for years. And for me, not being a clinician, not being a medical side dental professional, the fact that I helped her get to that outcome, even though I didn't personally do what my company did, was very fulfilling. And I changed something at my company after that. And I say this all the time. We're in company-wide meetings. We have about 80 employees. And we'll be talking about projections and numbers. And I'll say, all right, guys, I'm going to break this down simply now, okay? We book 30,000 dental appointments a month for practices. There are more smiles on earth because of you now than there was before. Forget the money. We are helping people get to their smile, and they don't even know we exist. And that moment made it very fulfilling for me, and it changed my compass on how I look at every lead we provide to every doc. And it's a person we're handing off to a doc. And we actually have an onboarding question with Energize about some of your clinical stuff and how risky you are. And if you're too risky, I get kind of odd about picking you up because I'm giving you a human.
I'll give you one more for our listeners, because that perspective is very important. That's the why. Some variant of that is the why for every single one of us. So here's the big question for everybody's morning huddle that I tell all my clients. Your morning huddle is going to be, your numbers, and Mrs. Jones is coming in, and there's some same day dentistry here, et cetera, et cetera. But let's end each morning huddle with this question: whose life will we make better today? And let's begin our next morning's huddle. Well, somebody raise their hand and tell me whose life they made better today. 30 seconds. One person, Helen Hygienist, raises her hand. Oh, Mrs. Jones doesn't bleed anymore. Archie, the associate, says, oh my goodness, I seeded this full mouth rehab, and oh my goodness, the patient is smiling again, that kind of thing. Whose life are we making better today?
I mean, that's like, you can go through life and get real selfish and focus on dollars in a bank account. Or you can be really fulfilled and leave life with no regrets. I think that's part of leaving life with no regrets.
And when we do that, when we do all that, Matt, guess who we help the most? Our own mental health. Our own mental health. That is one part of the anti-burnout. That will solve 50% of the burnout right then and there. Whose life are we making better today?
If we make someone else's life better, we make our own lives better.
Yeah.
Because we leave happy.
We haven't even gotten to health yet. I demand, I'm from Jersey. I got a guy. If you don't have me back to do things on health,
no, we're gonna have you back as a repeat.
I know a guy, Matt. I'm telling you, you better do it.
Yeah, we've only done a few repeat guests. You will be one of them. We've had
I would be very.
Justin Withrow, the lawyer, has been a repeat guest.
Justin is my man.
Yeah, Justin's. I don't care what anyone says. He's the best lawyer in dentistry. Period, bar none. If you are in the middle of an investigation or a dental board problem and you don't call Justin Withrow, you're making a giant mistake.
I love Justin, and
yeah,
I'm a believer. I am a big believer in Justin.
Yeah,
Withrow.
Me and Justin are close. I've referred a lot of clients to him. I trust him with my clients. So we have to wrap this up. Alan, really good insight. This kind of leads into us doing more episodes together. It's really good. Thank you for coming on with us and having this conversation. Is there anything you want to say before we sign off?
It's just an honor and privilege. And if anybody wants to get in touch with me, Alan at dralanstern.com. Very simple. And I'll spend a half hour with anybody, and I won't ask for money, won't sell them anything. I just want to listen.
I'm the same way, and people don't believe me. Like, is this going to be a sales call? I'm like, no, you said you need help. I'm going to make time for you. And it always comes back around. It always works out. They'll say, like, yeah, Matt from Energize, like, I was on a call with him for an hour. He knows this stuff. And somebody will be asking about marketing. And I'll say, I would recommend Matt. He treated me really good. And it all comes around. Well, hey, thanks for being on. Hey, everybody, Dental Unfiltered makes no money. We have nothing to sell you. No one's ever picked up to come on here because they're a sponsor. There's zero pay to play on this channel. The only thing we ask that makes us feel excited, please leave a review, like, share, and follow. This is a resource that we put out, that we really did because I thought the industry needed it. And also, our new book is out, Dental Unfiltered's Guide to be a Badass Practice Owner. We're trying to figure out how to distribute it right now to all the listeners. There'll be something put in the description of this episode on how to go about getting that book. And it's something, it was a passion project for me, and it was really awesome. And I really hope you guys enjoy it. So thank you guys so much for joining us, and have a great day.